Deputy Chief of Staff to Mayor Muriel Bowser, and I'm going to be joined tonight with members of the DC Health team to answer your questions related to the vaccination efforts here in the district. We're going to give it just a few seconds because I know a few people are dialing in of our neighborhood commissioners and our community leaders. But again, I want to remind everyone a few of our housekeeping items. So if you need interpreter services, we do have live interpretation occurring on our Facebook or Twitter streams, as well as on if you're joining us by phone and you would like to ask questions, you can press 0 now to be entered into the question queue. If you are watching on the Facebook or Twitter streams, you can also ask your questions directly there. We're going to hear first from the DC Health team on where we're at in the vaccination process, and then we really wanted to reserve a big chunk of the time on this call for Q&A and questions the vaccine process. So we have a lot of our members of our team from DC Health on there. So I'm just going to say one more reminder on that process, as we still have a bunch of people dialing in. That is, again, if you have any questions and you're joining us by phone, you can press 0 to be entered into the question queue, or you can ask your questions directly or Twitter streams. So to get us started, I am going to introduce Dr. Preetha Iyengar from DC Health. She is the COVID-19 with the COVID-19 Epidemiology Surveillance and Reporting Branch at DC Health, and she is a supervisory medical epidemiologist. That's a lot to say very fast. So, Dr. Preetha, I'm going to kick it over to you now to begin with the program.
Thanks, Thomas. Hi, everyone. Taking the time to talk with us tonight. So I'm just start off by kind of giving an overview of COVID-19, the vaccine, and answering some asked questions that we encounter, and of course how the district is distributing the vaccine before we get into the Q&A session. And our hope is, again, that after this you'll feel more comfortable as you get questions from your constituents, that you're able to answer both kind of facts and dispelling myths about the vaccine, and of course what is happening from DC Health and DC government. Reminder of COVID-19 basics. It's primarily a respiratory illness, thought to spread mainly from person to person when you're in close contact with them. Meaning that you're within 6 feet of someone for a total of 15 minutes over a 24-hour period. It spreads through respiratory droplets when someone coughs or sneezes. Spread COVID starting from 2 days before symptoms begin. And some people with COVID don't have any symptoms, and they can spread it when they're asymptomatic. In about 50% of people, and is largely contributing to the spread. The signs and symptoms, I'm sure you're all familiar with now, but the symptoms can appear 2 to 14 days after exposure, and range really from mild to severe, from fever, cough, shortness of breath, simple runny nose, sore throat, and now very classic smell. Those are just some of the symptoms. So the COVID-19 vaccine. So there are currently 2 vaccines available. That's the Pfizer, BioNTech, and the Moderna vaccines. They're both mRNA vaccines, so I'll talk a little bit more about. Both require 2 doses, those are our 2 doses, and there are more vaccines that are being tested and should be coming available soon. That will be different types of vaccines and also will have different dose requirements. So why should people get the vaccine? So, really it's to protect yourself, your coworkers, and your loved ones. Both of these vaccines that are currently available are about 95% effective at preventing COVID-19 illness. And the goal being for enough people in the community to get the vaccine so that we reach herd immunity, which is the term you might also have heard, which means enough people in a population are immune to an infection. Once we get to that level, the virus has a hard time finding new people to infect. So that's kind of the goal, both for ourselves, to protect ourselves, and also to protect those around us. So how do mRNA vaccines work? So mRNA stands for messenger RNA, which you can think of as a blueprint for that living things use to make proteins. So what this technology has been studied for decades, but these are the first vaccines that are made using mRNA technology. So what the vaccines do is basically the vaccines carry genetic material, and that teaches your own cells how to make something called the spike protein, the spike protein of the SARS-CoV-2 virus. And your body is then able to make that spike protein, and it basically, your body then reacts and makes antibodies against that spike protein. The mRNA that came into your body from the vaccine degrades. A common thing that people are worried about is that it alters your DNA. It doesn't enter the cell nucleus. It cannot affect your DNA. It kind of tells your cells how to make this protein, make a copy of this protein that is usually found with the virus, and then it degrades away. And that's basically how it's kind of like teaching our body to make a protein that is found on that virus, so that our bodies can create an immune response and then be ready when you're actually exposed to the coronavirus. It can be ready to basically to fight and prevent you from getting sick with the disease. And just an important point to bring up with the vaccines. So with the mRNA vaccines, you cannot get COVID-19 from an mRNA vaccine. Again, it's kind of mimicking that response. That's, I know, a common concern with a lot of vaccines, and in this case, you can't get COVID-19 from an mRNA vaccine. The vaccine does have side effects. Common side effects are, pain at the injection site, which you see with other vaccines, but people also have a fever. I know it can really cause a lot of fatigue in people. You can get headache, chills, aches, and joint pains, and they can be pretty mild, but some people definitely have more intense symptoms 3 days after getting the vaccine, and typically more people have it after the second dose. It seems like from the trials, it was worse in those that were aged less than 55, but they usually go away in about 1 to 2 days. I know that from what I've heard, people who have got the vaccine after the second dose have had at least a day of sleep ahead of them. So I wanted to talk a little bit about the vaccination plan in DC. So I think, an important thing to remember, and what shapes a lot of our vaccine plans, demand for the vaccine in DC is much higher than the supply that we receive from the federal government. You've seen probably Mayor Bowser and Dr. Nesbitt continuing to advocate to get more vaccine so that we can meet the demand for it that we have in the community and protect the lives of our residents and our workforce. DC receives about 8,500 first doses per week. And we have, we allocate 75% of that to our aim. The aim is reducing morbidity or mortality. I'll go into that a little bit more in a second. And then the remaining 25% is allocated to preserving societal functions. And so not only are we only receiving a certain amount of vaccine, we actually have a timeline for when that might increase, I should say. And we also don't have a great level of predictability about how much vaccine we're going to receive. When we get the number of first dose, we matched, but outside of that, we find out what our allocation is going to be on a Wednesday, and then later that day, that number is released. And we don't have we don't get any information beyond that. And I know that that's a point of frustration that we share with everyone who's asking us those questions. So again, the vaccine is distributed based on two goals: reducing mortality, so basically illness and death, and then preserving societal functions. So vaccines are being sent to settings in phases and tiers to target priority groups. And when demand for a given group drops below 90%, the district can move on to the next phase or tier. So you can see how the amount of vaccine we receive really dictates how we're able to move through the groups. And these these tiers that we've decided are based on the CDC and ACIP guidelines. So a little on the vaccine prioritization strategy. As of today, DC is in phase 1B in tier 2 of distribution. So in tier 1, we're healthcare workers and frontline personnel, fire and emergency personnel, long-term care residents. In phase 1B tier 1, we're congregate settings, which include like correctional officers, and also non-healthcare personnel supporting operations of COVID-19 clinics, vaccine clinics, and now in phase 1B, tier 2. Again, continuation of the previous groups, including detention centers, and then for preservation of societal functioning, has law enforcement and public safety, staff working in K through 12, education, child care facilities, and in grocery stores. We're also really focusing or putting efforts into community engagement and to address vaccine hesitancy. We have a credible messenger program, populations including Latinx, African American, and immigrant communities. It includes outreach and a call center. We're performing qualitative research to understand COVID-19 vaccine hesitancy and to support uptake. These are focus groups done in partnerships with George Washington University to talk to persons that might be at risk of higher exposure to COVID-19, such as communities of colors, essential workers. And we have a partnership with the Medical Society of the District of Columbia, and that's to identify a cadre of physicians to support community conversations about COVID-19 vaccine, and also multiple strategic communication campaigns, which include traditional and non-traditional media and multilingual messaging. For people to get more information about the vaccine and accessing the vaccine, the information is available at coronavirus.dc.gov /vaccinatedc. You can sign up to get updates and learn when the district registry opens for us. So a phone number, 855-363-0333. So I know I'm running a little short on time, but just to go through a couple of commonly asked questions. People often ask if they'll get protection after the first dose. The two available vaccines right now are only designed to work with 2 doses, and full protection is about 2 weeks after the second dose. We get questions around how can people trust that the vaccine is safe? And we have to remind people that there's concern, of course, quickly, but it was held to the same safety standards as previous vaccines and were skipped. What set things up is that the vaccine was manufactured proactively while the clinical trials were still in progress, which typically doesn't happen because it could result in a huge loss of money if the vaccine is not proven to be effective. The vaccines were tested on both trials, like tens of thousands of people of diverse races and ethnicity. They were large enough to detect any major safety concerns, but not rare events, which really only occurs when millions of people are vaccinated. And clinical trial participants are continuing to be monitored so that we can gain more information about the vaccines. Another question is, after you get the vaccine, can you stop wearing a mask and social distancing? And the answer right now is no. We do know that what the vaccine prevents is it prevents you from having symptomatic disease. So they're still studying to learn if it prevents people from, being infected and being asymptomatic and possibly spreading it to others. So we're still learning more about it. As we're still having, as we're ramping up, getting to high levels of vaccination in the community, we all have to kind of continue to take precautions. But at least know if we're exposed, if you're vaccinated, that the risk of you getting sick is, obviously much less. Do you need to get the vaccine if you've already had COVID-19? Also, the answer is yes, as we don't know how long, we're still learning more about how long natural immunity lasts after COVID infection. And there's some thought that vaccination can boost the immunity you've had from a previous COVID infection. Will the vaccine work on the mutant strains that are being detected? So we've gotten recent news from both Moderna and Pfizer that they're not having quite as strong of a reaction. So Moderna and Pfizer are but again, as we're seeing more of these mutations occur, it kind of gives us even more reason to kind of make sure that we have engagement so that people are really getting vaccinated and implementing the other preventive measures. And in DC also, questions around will you have to pay for the vaccine? No, they're provided free of charge, although providers can charge a fee, but should be covered by the insurance. And then the other question that we typically get is if people can get the vaccine if they're undocumented. And yes, you don't need an ID. You can present alternate forms of identification, like bills and paychecks, to access the vaccine. So I wanted to stop there and open it up for questions. And I'm here with members of the immunization team as well. So between our group, we're happy to answer any questions you may have.
Thank you, Dr. Preetha. And before we go to Q&A, I want to remind everyone again, if you're joining us by phone, you can ask your questions by pressing 0 to be entered into the question queue. If you're watching online through our Facebook or Twitter stream, you can ask your questions directly there as well. We'll take questions from both places. A lot of questions queuing up, which I appreciate. Joining Dr. Preetha to answer questions, we also have Heather Burris, who is the COVID-19 vaccine planning team lead, Kimberly Harris, who is the director of the DC Primary Care Office, and Dr. Kimberly Henderson, who's the director of communications and community relations for DC Health. So I want to let you all know who's also on hand to answer questions. So we're going to go to our first question from Commissioner Harnett, James Harnett. Your line is unmuted, Commissioner.
Hi, thanks for taking my question. I was wondering if now that the White House is sharing more information about allotments for the next 3 weeks, if DC Health had an estimate for when we'll be moving into the next phases. I remember the mayor talked about a few weeks ago that we had an estimate for the end of January to start vaccinating teachers, MPD officers, and the like. I was wondering if you could comment more on when we can expect to be moving forward through those phases.
Hi. So Heather, do you want to jump in for that one?
Hi, good evening, everyone. We don't have a phased out timeline right now. We're currently working with the dose allocations on a week-by-week basis. So it is a little bit challenging to, without further knowledge of what we can expect from the CDC. January was a little bit different in that in the beginning of the month, we had a little bit of a heads up that our doses would stabilize at that rate and allocation for the month, but we haven't received guidance yet for February that would lend itself to additional planning in terms of moving through some of these additional phases. Additionally to that, it's also dependent on the uptake. And right now, our senior population is heavily utilizing the vaccine opportunities. So we're keep making them available as long as there is interest. So without further information in terms of allocations and planning, it is hard to say confidently when we can move into some of these additional substrata.
And I do want to add, we're appreciative of the Biden administration with their increase in the allotment. I think you heard the mayor, if you watched the press conference this morning, DC needs more vaccine, and we will continue to push our federal partners on that. So, I think all of our great commissioners, a lot of y'all have some great social meetings, so we'll hope you'll help promote that call of DC. We're going to get our next question from online from one of our commissioners. Questions related from residents that got their first dose in a different state, but are wondering if they can get their second dose in DC if they got their first dose in a different state.
I can take that one too. So we've been receiving a lot of inquiries around this as well at Vaccinate.DC at dc.gov. And technically, we are not in a position where we're able to deny anyone vaccine who has already received a first dose. So, yes, they can receive their second dose vaccine. Fortunately, we don't expect that number to be high, or at least we haven't seen inquiries about that number being high. But it does present some logistical challenges that we've referred up to the CDC and are still waiting for feedback about this because it does impact our inventory management system, and being able to give doses to people who never received a first dose just throws things off logistically speaking. So we're still seeking guidance on that to be able to provide a better answer. But for the immediate need, no one is being turned away when they are coming with this situation.
And I do want to remind everyone, if you are on the phone and would like to ask a question, you can press 0 now to be entered into the question queue to answer your question. The next question is from Commissioner Pasternak. Commissioner Pasternak, your line is unmuted.
Good evening. Thank you so much. I was wondering if new appointments will be available at a time other than 9 a.m. Some folks might not be able to jump on at 9, but could maybe do an evening or a different time of day.
We haven't discussed that yet, but thank you for that feedback. We can certainly take it back to the team to further deliberate about that. That's appreciated.
And that's a good time to remind everyone again that we do appreciate that feedback, Commissioner. But for tomorrow, the next batch of vaccine that's available for residents citywide does open on the portal and at the call center or the call hotline, tomorrow at 9 a.m. So for seniors 65 and older that are eligible. So just ensure. Again, for the time being, tomorrow there will be an additional allotment of appointments available to residents citywide at 9 a.m. tomorrow. So just want to remind everyone about that again. Can we go next to Commissioner Gosselin? Commissioner Gosselin, your line is unmuted.
Great, thank you very much. I just want to ask you to think about both at the DC Vaccinate site and encouraging the hospitals and providers to do the same, to make a list. I think it would reassure people, even if the wait were weeks or a month, that they were in queue. The implication, at least the implication I took when I went on the site as a 70-year-old to try to sign up, was that if I couldn't sign up at the Vaccinate DC site, I could go to these providers. In fact, almost none of the sites will tell you you're on a list. They should give you no opportunity to at least understand that you've gotten on a list. So I encourage you to think of ways to do that.
Thank you, Dee.
Yeah, thank you for that feedback.
We're going to go next to another submitted online question from a commissioner. This question is I'm getting a lot of questions from residents how long should they wait if they got the flu vaccine recently? How long should they wait before getting their first dose of the vaccine?
There hasn't been any interaction. There is much data about taking the two vaccines at the same time. I need to just, grab my notes regarding that specific issue. But it shouldn't be co-administered, like administered at the same time with any other vaccine. But between the flu vaccine and the it should just be, they only have to, if they can delay it for 2 weeks, that would be ideal.
Thank you, Dr. Preetha. I'm going to go next to Commissioner Schenkel. Commissioner Schenkel, your line is on.
Hi there. Thank you so much for taking my call, and I just want to commend all of you for your work in this unprecedented time trying to figure this all out. I have a number of elderly individuals living in my SMD who have tried repeatedly to access via the internet or using the telephone line and have been unsuccessful in doing so. And one that has been noted is that the online scheduling system does not save any of your data. So if you can't find an appointment, you are basically bumped out and have to start all over again. What should these individuals do, and how is the system being enhanced?
So I can take this question. This is Kim Henderson, the Director of Communications for DC Health. What we will recommend first is that they would actually use our phone line if they're able to call in to make their appointment. We have increased our call center capacity. We have over 200 persons who are available to answer calls, so people can get through that line faster than they have been before. We have also done a few other enhancements to Vaccinate.dc.gov in order for the process to move faster for persons to actually register for an appointment. But as you know, appointments do go very quickly. The only other option that we have at this particular time is for people to continue to come back when we have appointments available. We're in a cadence right now of having appointments available every Thursday, Friday, at 9 a.m. And again, we'll take the feedback of looking at how we can potentially change the time so that it'll be more convenient for other folks. But we do ask that people just continue to come back and really work with us. And we understand that this has been a trying time, that everyone is experiencing a lot of about not being able to get and frustration about not being able to get an appointment. But again, we do have a limited number of doses. It means that we have a limited number of appointments. So we are continuing to, as Tomas and other colleagues from DC Health said, we're continuing to ask the federal government for additional doses so that we can help alleviate and eliminate some of the problems that we're having with registering.
Thank you, Dr. Kim. We have time for just a few more additional questions, so I do want to remind, if you're joining us on the phone, you can press 0 to be entered in the question queue to be able to ask your question. We just have time for just a few more. I'm getting a question online. With COVID cases and deaths disproportionately affecting Latino and African American communities, what is DC Health doing to share information with those communities related and ensure that they are getting the vaccine?
Kim Harris from Immunization Team. Jump in on regarding the communication plan regarding that, the communication and engagement plan we have regarding that. I apologize, my phone was muted. So we have a number. We've been partnering with our health centers as well as our community-based organizations in terms of communication about testing, vaccine administration, and how we're distributing the vaccine. The DC Health Communications Department has developed a toolkit for a number of communications for the elderly population. We've been working with those that are people of color as well in terms of the information that we're providing. Specifically, the vaccine hesitancy study, which is the qualitative study that Dr. Preetha mentioned earlier, is going to give us some additional information just to have a better understanding about what is some of the hesitancy around the vaccine, receiving the vaccine. There's a number of communications that we're going to be working on to debunk some of the myths that are around receiving the vaccine, as well as the lack of trust around the administration of the vaccine. Recently, also been working with our health centers to make sure that we have information around testing, around vaccine administration, but also trying to make sure that we are not leaving out the other primary care needs. So reaching out to those folks who have chronic diseases, as well as making sure that children are getting their childhood vaccines so that they're not falling out of coverage. Also, the regular communications around not spreading the virus. So still washing your hands. You still want to do that, wearing your mask, avoiding, large gatherings. That communication is going through the health centers, as well as the messaging from the community-based organizations. And then we're also working with Medical Society of DC to have a team of health professionals that would be available for a variety of community-based events to answer questions, to provide additional information. And these forums are also helpful. We take every feedback and comments and see how we can adjustments and pivoting to the messages with some of the questions that we get that come in, some that we anticipated and some that we didn't. The other piece in this is that we are looking for all kinds of partners. We meet weekly with some community-based partners to share some of the initiatives that are going on so that there is not any duplication of efforts and we're all sort of aligned, but also, again, in that information and making sure that we can some of the concerns that the community has had working with faith-based organizations and really, doing some grassroots initiatives.
Great. Thank you so much. And I just want to add as well, we're also targeting those communities that have been disproportionately hit as well through not just online or social media ways of reaching them. Done targeted mailers this week in Ward 7 and 8 at seniors 65 and older about the vaccine and vaccination process. We've also done robo-dials through to several communities across the district as well. So we're looking at those other means of communication as well to get the word out. So I just wanted to add that as well. We're going to go to Commissioner Chang next. Commissioner, your line is unmuted.
Thank you so much. My question follows Commissioner Schenkel's question about the online system, and I understand that you're asking people to use the phone line, but those who have used the online system has had trouble with the CAPTCHA function where they believe they've correctly identified the photos, the images, and then they press submit, and it says error maybe 2 or 3 times, and it's been very frustrating. So wondering if there's a bug in the IT system. So wanted to alert you to that. And thank you so much for increasing the call center capacity, because I have also received complaints from constituents saying that they're like 350th on the line and then they're thrown off the line, so they're not even in queue any longer. So thank you.
Thank you for the feedback and comments. I do want to let you know that the capture has been removed from the platform, so that should no longer be an issue.
Let me actually jump in there to Dr. Kim. So, yeah, as Dr. Kim said, we did remove the CAPTCHA from the booking part of the portal, and so that was where we were seeing the issues. There is still a CAPTCHA during the initial screening, and that's required to secure the site, but Okta, the third-party vendor, Microsoft, who oversees the portal, Okta has worked with them to ensure enhanced performance of that initial screening CAPTCHA that is required to secure the site. But Commissioner Chang, thank you for flagging that. We heard that, and I appreciate the Okta team working with the vendor to ensure that was remedied and that they removed that second CAPTCHA that was there and during the booking process. So that has been removed. So just want to clarify that, and the those fixes yesterday. So we're happy to share those with y'all. We're going to go to our next question, and I think time for just two more. Commissioner Huff, your line is unmuted.
Hi, thank you so much for having this tonight. I've heard from frustrated residents in my SMD for times. We had Walmart today to have the vaccine. So my question is, how are you working with Walmart, Giant, Safeway? Because I'm hearing all sorts of people saying, "Oh well, I saw it over at Giant." I'm going to reach out to the manager to find out, how they're notifying people. They had only 10 people in line per the constituent who notified me earlier. So that was the first part, and then she also, residents are letting me know. Veterans are going over to VA. She had problems getting through the line. She and her husband were frantic, so they called Washington Hospital Center because he was having surgery, and there was a prompt that you could get the vaccine at Washington Hospital Center. So I agree that all of the information needs to be filtered, and I'm so grateful for our board for Mocha Anthony Mitchell, because I'm filtering. He's filtering. We're working together to get the information out to seniors who don't have a computer, who don't know how to text in the community. And then the other question that some of the seniors have asked or residents have asked is, how can people, is there a way that they can volunteer to help get out accurate information to help those seniors who will only work off of a phone call or the paper? Because even when you put paper in a community, that does not ensure that people are going to read it. So I've been calling the constituents and throughout the ward, because in my former job, I was in Ward 4 in its entirety. And so people are still calling me to find out information and where can they go, because they want to get the vaccine. So again, I want to say thank you. I just wonder how all of this information is populated in a way that they have some direction of where to go, whether you're a vet or whatever it is. Thank you.
Sure. Thank you for that feedback. So I do understand the limitation with things being available online, but we don't publish the actual site intentionally where the vaccine is going to be located outside of the portal, because we don't want residents to just show up and kind of flood those spaces. That initially was happening significantly at a problem at grocery stores. There was crowding, and we required some security support. So we've stopped doing that. So Walmart became a provider recently in the last week, and this first week actually having appointments scheduled in the portal. Walmart was full in terms of vaccination. So it may be this person who observed only saw the limited time frame that they happened to be in the store. But is a new provider that's been onboarded as well as working with Safeway and Giant pharmacies. And that is a significant portion of the appointments in the portal. The other piece that you mentioned about the person being able to be vaccinated at Washington Hospital Center, that's awesome, and that's great, and that's another message and avenue that we want to make sure is being spread in the community, which is also listed on the vaccinate.dc.gov page. There's a list of organizations, facilities in the city supplied with vaccine for their patients. For example, all of our acute care facilities who were initially administering Pfizer vaccine to their healthcare populations, they've now transitioned to be able to provide vaccine for their patients. And when I say their patients, what the definition, if someone had been seen at the facility in an outpatient clinic capacity within the last 2 years, those hospitals have reached out to those patients and are inviting them to come and get vaccinated when there's vaccine available. So the quantities may be a little bit limited, so people should always call their healthcare provider first, but the hospitals have vaccine, and then additionally on that page lists the federally qualified health centers in the community, where we've also initially enrolled in the portal and now since have pulled back so that they can vaccinate those patients too that are already part of their cohort. So I'll stop there for that piece of the question and turn it over to Kim to talk about some of the more communication response to your question.
Yes, thank you for that feedback. We have, like I mentioned earlier, we met with the community-based organizations today, and the communication specifically around seniors and providing assistance so that they can get connected and register for the vaccine was on the list. Our partners are looking at strategies to see how we can assist the seniors that aren't connected to text messaging as well as technology. We had a couple of ANC, a member who was willing to do that, as well as some of the community-based organizations. So we need to just flesh out what that strategy would look like, but that's certainly on the agenda in terms of being able to get seniors connected who may not be, reading the papers or the flyers that we're putting out or have access to technology or text messaging.
Thank you so much. Just again, want to remind everyone, we have time for one last question, but DC Health, as they said, you can go to dc.gov. What's remind me of the email address if residents are having any tech issues or if they haven't received their confirmation email when booking through the portal. What that email, DC Health team, can you remind the ANC commissioners of that email?
Sure, it's vaccinatedc@dc.gov.
Thank you for that. So again, that's vaccinatedc@dc.gov. So we're going to go to, we only have time for our last question, so we're going to go to Commissioner Palmer. Commissioner Palmer, your line is unmuted.
Thank you. Thank you so much. I was just wondering if you could give some details about outreach to communities that don't speak English.
Oh, DC Health Team, I don't know if your lines are muted or not. I don't know if you got dropped from the call.
So this is Dr. Henderson. We have done our communities that do not speak English as their language. In particular, myself and my office, along in partnership with the mayor's office, has worked with the mayor's offices of, and I'm blanking, mayor's office that focuses on residents who speak Spanish, who speak Vietnamese, Chinese, et cetera, the 7 official languages of the district. We've also looked at translating all of our materials into those official 7 languages to make sure and ensure that residents have access, the same access to the information as those who speak English primarily as their first language. We have community outreach persons who do go into the community and who provide information, who are boots on the ground, who speak with those various communities, inform them of that information. And we also, through our other community outreach efforts, have persons who do speak various languages and who also go into the community as well to provide information and answer any questions. So we do have a robust program involved to make sure that we are not limiting ourselves to only English, but also including others who speak the other official languages of the district. Tomas.
And just to add to that, this is same thing with our community-based partners. We work with the Latin American Youth Center and a few other organizations that have a reach to those who don't speak English, and with the help of Dr. Henderson's team and making sure that we have those communications in various languages, that is how we're also pushing that out to the community through our community-based partners.
All right, that is all the time we have for this evening. I do want to thank our team at DC Health for being on tonight and answering all of our commissioners' questions. I know to get to all of the questions, so commissioners, I do want to remind you that you can flag through your MOCRS rep liaisons, and they will make sure that they share any unanswered questions this evening with the DC Health team for a response. I want to thank our DC MOCRS for all the work they do and for helping us spread the word with our commissioners for this evening's call. And again, for just in general, all of our most up-to-date information and resources related to the response and recovery efforts are available at coronavirus.dc.gov. And for our new commissioners, I know we have a lot of new commissioners and are now in office. First, congratulations, and we look forward to working with you. But want to remind all of you on the line that we have a community call that is usually weekly on Wednesdays at 5 p.m., where the main focus is the district's coronavirus response and recovery efforts. This week we did focus it on DCPS Term 3 reopening, but that call is every Wednesday at 5, and your MOCRS will share that information with you for the dial-in. We will hope that you will join us for that call. We really appreciate getting all of our commissioners on that call and answering your questions, so we hope you will join us next Wednesday at 5 o'clock for that call, and the MOCRS will follow up with more information on that call. So thank you all so much for joining us this evening, and we'll talk to you soon.
We now return to our previously scheduled program, already in progress.
Marked, file your claim online, and finally,